Hi guys, how are you doing? I hope you are doing well and welcome to today's session of learning. Today we are going to learn about family planning, a very interesting topic, and so I want to take you through all the methods of family planning, all the advantages of each method, the disadvantages of each method, so that you can be able to know which one will work best for you, and so that you can be able to choose the best. So family planning is the practice of controlling the number of children one has, and also spacing between or interval between your children. So it helps you to attain your desired number of children, and also it helps you to space your children. So family planning will help you if you want to have, let's say, 5 kids. Through family planning, it will help you to have your desired number, so that you can't have more or less, and also it will help you to space, so that you just don't give birth unplanned, or so that you can, if you want to have a baby maybe after 2 years or 3 years or 5 years, so that you can know which is the best method to use between the intervals of your children. So a point to note, there's only one method of family planning that prevents both pregnancy and sexually transmitted diseases. There's only one method of family planning that will prevent both pregnancy and sexually transmitted diseases, and that is condoms. This is the only method that will prevent sexually transmitted diseases, for example HIV, and also prevent pregnancy. But the rest of the methods, they will prevent pregnancy, but they won't protect you from sexually transmitted diseases. All the methods will prevent from pregnancy, but you can be able to get sexually transmitted diseases. So so the methods of family planning. Number one, we have natural methods. Under natural methods, we have abstinence, we have calendar method, we have basal body temperature, we have coitus interruptus, we also have lactation amenorrhea method. Do not worry, I will take you through each method so that you can be able to understand well. Number two, we have barriers. Under barriers, we have condoms, we have cervical caps, and we also have diaphragm. And number three, we have hormonal methods. Under hormonal methods, we have Depo-Provera. We also have oral contraceptives, and also we have implants. Okay, and then the fourth one, we have non-hormonal methods. And under this one, we have one that is intrauterine device called copper T, or mostly known as a coil. So family planning methods are majorly divided to 4. We have natural methods, we have barriers, we have hormonal and non-hormonal methods. So today we will start with number one, the natural methods. And under the natural methods, so what are natural methods? Natural method uses body physiological changes and symptoms to identify fertile and unfertile days. So as you see, under natural family planning methods, you don't use you don't use hormonal medications. So you will use the body's physiological changes to identify the safe and unsafe days of your cycle. So under natural methods, today we will talk about abstinence and calendar method. We will talk about two. So abstinence is simply avoiding sex totally, and this one it works best with people who are not married. So if you are not married yet and you don't want to have a baby, the best method for you is just to abstain from sexual so that that is the only sure way you cannot get pregnant. So for those people who are not married, just abstain from sex. Wait till the right time. When you get married, that is when now you can plan to have a baby. Number two, we have calendar method, or another word called periodic abstinence. So this calendar method is when you use your menstruation cycle to know the safe and unsafe days. It is very tricky. It is very tricky. So you have to be very, very cautious and very, very careful. And you have to know your cycle well. You have to understand your menstruation cycle very well. And so, first of all, you have to know how many days does your cycle have. By that I mean, like after how many days do you usually menstruate? Do you have a regular cycle or do you have an irregular cycle? For those people who have an irregular cycle, this method is not recommended for you, because if your cycle is irregular, then you might find that you have messed yourself. So this is recommended for those people who have a regular cycle, and so that so that you can know. That is the only way you can know those safe and unsafe days. But if your cycle is irregular, then it will be so tricky, and you can get pregnant. So a woman's cycle is different for every woman or for every lady. There are people who have a 27-day cycle, 28, 29. Some people go even up to 31 days. So you have to understand yourself. So I have a simple illustration here of a 31-day cycle. So you will start by counting days from the day you start menstruating. So from the day you start menstruating, let's say you start menstruating on date one. So you will count 7 days from the day you start menstruating. So let's say you are having menses from day 1 first to day 5. Then when you finish your menstruation here, you give yourself 2 days. So count 7 days from the day you start menstruating. So let's say you started your menses on day 1, on fast. So you will count here from day 1 to day 7. These when you are menstruating, you are infertile because the ovaries, the uterus lining is shedding because you didn't conceive. So that means you are infertile. The uterus is shedding plus the ovary that was released, it was not fertilized. So when they shed out, that is what we call menstruation. So from day 8 to day 19, these are fertile days. So from day 1 to day 7, you are infertile. Then from day 8 to day 19, you are very fertile. So what happens after you have finished menstruating? You will now your ovaries will again be ready to be released. So between date 8 to date 19, between date 8 to date 11, you are semi-fertile. That means you can get pregnant or not. You are in between. You can or you cannot. And then from date 11 to date 16, between here, this is the days you are most likely to ovulate. So ovulation is simply the release of an ovum from the ovary. Okay, a mature egg is released from the ovary so that it can travel through the fallopian tube to the uterus so that it can be able to meet with the sperm. So if you have sex between date 8 to date 10, you know, a sperm can stay alive in the female reproductive system for up to 5 days. So you know the environment there is conducive, so it can stay alive for 5 days. So let's say immediately you finish your menstruation, you decide to now have sex on date 8. See, and then this sperm stays alive from date 8, let's say 1, 2, 3, 4, 5. You see, by the time you're ovulating, this sperm will still be viable. It is still alive and it can fertilize this egg that is released from the ovary. So to be on a safer side, that's why we say there's between here and here it's semi-fertile. So that sperm that once you have sex, the sperm can stay alive in the reproductive system of a female up to 5 days. So if you have sex here or even on the 7th day, this sperm will stay alive, and the moment the egg is released, it will be fertilized, and that is how you will get pregnant. So from date 8 of your from date 8, once you finish menstruation from day 1 to day 7, from day 8, do not have unprotected sex because you might get pregnant. So between date 8 to date 19, these are very unsafe days. So do not have unprotected sex. So between date 11 and date 16, the egg will be released. That is what we call ovulation, release of an egg from the ovary. And then once you finish ovulating, the ovum, the egg that was released from the ovary, it can also stay for up to 24 hours. It is viable in the reproductive system. So let's say ovulation took place here on the 14th day, and then it stays here for 2 days, okay? And then you have sex between these days. Fertilization might take place. So give yourself these 3 days, so that to be sure that the ovum or the egg that was released dies. Okay, so do not have unprotected sex between these days. Okay, so make sure you use protection. So from date 20 till the time you start your menstruation cycle again, these are infertile days, so these are safe days. You can have unprotected sex. Okay, these are safe. These are very unsafe. So, in simple terms, if your cycle lasts for 27 to 28 days, I mean from the time you started menstruation till the next time you start menstruating, if it is between 27 to 28 days, make sure you avoid unprotected sex from date 9 to date 19 of your cycle. From date 9 to date 19. That is if you have a short cycle, 27 to 28 days. But if your cycle is long, between 30 to 31 days, avoid unprotected sex between date 9 to date 20. Okay? Yeah. Yeah. So, from the day you start menstruation, count 7 days. From the 8th day to the 19th day, very unsafe days. From the 20th day to the time you again start menstruation, those are safe days. So during these unsafe days, you can use any family planning method. You can use condoms. You can use coitus interrupters, or any other method that you are comfortable with, so that you do not get unplanned pregnancy. So yeah, I want you to understand what is ovulation. Ovulation is when an egg is released from the ovary so that it can be fertilized by a sperm. So the signs of ovulation, how do you know you are ovulating? Number one, some women have increased desire of sex or urge. Some women develop breast tenderness. We have high temperatures, body temperatures. We have some people have pelvic pain or low abdominal pains. And then we have some people spots. Some people have nausea and vomiting and headaches. And also we have increased cervical mucus. Okay, so those are the signs of ovulation. That is how you can know that you are ovulating. I know so many women or ladies understand during the ovulation time. Many people know, so it's good to understand your body, know all these changes, so that you can be able to monitor yourself, know the safe days, know the unsafe days. Yeah, so that you can avoid unplanned pregnancies. So today we have tackled the natural method, and under the natural method we have talked about abstinence and also calendar method. So I hope you have learned something, and please share this video, and also please subscribe so that we can continue learning. Thank you for tuning in.